Hi, my name's Chloe. I'm a HPV dietitian specialising in pancreatic disease. Now, November is Kranky Panky Month, and I'm here to tell you all about my favourite organ, the pancreas. Now, I would say that the pancreas is one of the most overlooked organs in our bodies. If you generally ask people what the pancreas does, then most people will usually say something along the lines of, it produces insulin, or something related to diabetes. Now, that is true, but actually the endocrine cells that produce hormones such as insulin and glucagon to maintain our blood sugars only make up 1% of our pancreatic cells. The other 99% are exocrine function cells, which help to produce digestive enzymes and pancreatic fluid to help us with the absorption of nutrients. The pancreas produces several key digestive enzymes, mainly released into the small intestine to help us break down food. The three major ones are amylase, which help us to break carbohydrates down into simple sugars, lipase, which help break fat down into fatty acids and glycerols, and proteases, which help to break down proteins into smaller peptides and amino acids. These enzymes allow our body to digest the nutrients from our food, making sure that we remain healthy and well nourished. Now, if we have an issue with the release of pancreatic enzymes from our pancreas due to a condition such as pancreatitis, for example, then it means that we are not able to absorb the nutrients from our food as we should be and can lead to a high risk of malabsorption. This is called pancreatic exocrine insufficiency, or maybe shortened to PEI. Pancreatic exocrine insufficiency is defined as a reduction of pancreatic enzyme activity in the intestine at a level that prevents normal digestion. In simple terms, this leads to malabsorption, which then leads to weight loss and nutritional deficiencies. The early symptoms of PEI include abdominal discomfort, bloating, flatulence and burping, larger stool volumes and more frequent bowel movements, urgency after eating, nausea, vomiting and reflux. The late symptoms of PEI include things like yellow or pale coloured stools that are oily or greasy to look at. They can be difficult to flush away and can be foul or offensive smelling. There may also be bits of undigested food in there, but sweet corn doesn't count. No one digests sweet corn properly. Pancreatic exocrine insufficiency can affect up to 90% of patients with chronic pancreatitis. If you're concerned that you may have PEI, then please contact your GP or your consultant to arrange a fecal elastase test. Now, this is a really simple stool sample that we submit for testing to check how many digestive enzymes are in your stools. And if this comes back low, then we can give you some supplements called pancreatic enzyme replacement therapies to help support with this. It's really important that when you submit your sample that you make sure that it's nice and solid for us, because a loose sample can give us a false result and you might end up taking medication that you don't need.